All I'm going to say is that if you live in Ireland at this point in time and you need access to a hospital, you need to get admitted to a hospital, or you need an ambulance at this time, my thoughts and prayers are with you. Things are in a right old state at the minute, and we're going to dig into that in a little bit of detail in just a minute. My name is Rick Munn. This is No Risk, No Reward Media. And if you are enjoying the content, if you like what you're seeing at the minute, not me, the content, but please subscribe to the channel and feel free to share the content freely. Cut and paste the links to the videos or the channel, drop them into social media groups that you may be part of, WhatsApp groups, Facebook groups, whatever. We need to get the word out there on what's happening in the world, especially many of the failings that are happening with systems in Ireland at this point in time. So, just today, very briefly, I want to focus on the health service or the failing health service in Ireland, both north and south. Just taking a collection of stories that I've seen over the last few days, and I'm just going to run through them very, very briefly here. First up, we have in Northern Ireland, emergency department environment is undignified, says a nurse who was interviewed just a few days ago. 2 elderly patients have been in the emergency department of the Royal Victoria Hospital in Belfast for more than 5 days. BBC News Northern Ireland can reveal. Imagine that, 5 days stuck in the emergency department of the Royal Victoria Hospital over the Christmas period as elderly people. Can't have been a particularly pleasant stay for them. This comes after more than 500 patients were unable to be discharged from Northern Ireland's hospitals on Sunday night, that's last Sunday night, despite being medically fit. With no suitable care for them in the community, it meant that they remained in beds, preventing other sick people from being admitted to hospital wards. And this is a problem in Northern Ireland's hospitals in general, that maybe people aren't aware of. There's a lot of people, a lot of bed spaces are being taken up by people that are able to leave the hospital but can't do so because they don't have any caring facilities in place should they go back home again. So they're fit and well, or at least fit and well enough to be able to be discharged from the hospital. They're healthy, for want of a better expression, but they're taking up bed space that could be used by sick people that need to be treated because they have no one to look after them when they go back into the community again. So it's not just a problem that resides within the hospitals themselves. So, as the article states, with no suitable care for them in the community, it meant they stay in beds, preventing other sick people from being admitted to hospital wards. Can you imagine that? Can you imagine lying, those 2 elderly folk, for example, lying in the emergency department for 5 days, knowing 500 people were taking up beds in hospitals that were fit and well, or fit and well enough to be discharged from the hospital, but yet they had to remain there because there was no care in the community. It's an absolute farce. So lead nurse Claire Wilmot has said that staff in the Royal Victoria Hospital were treating the most vulnerable elderly sick patients in an intolerable environment, and she described it as undignified. So if you're ill, if you've just had an accident, if you're in a very, very bad way, you're going to want to be in an environment that's conducive to you becoming well again or healthy again ASAP. This doesn't look like the case in the Royal Victoria Hospital in Belfast, treating the most vulnerable elderly sick patients in an intolerable environment, undignified. So if you were to give a wish list for the conditions you would want to recover from sickness or injury in, I would say that intolerable and undignified would not be 2 of the criteria. So that's the Royal Victoria Hospital in Belfast. We also have an article here from the 28th of December, updated on the 29th. That's just last week. Again, over the Christmas period, almost 400 patients waiting for hospital beds. Where's this? Saturday afternoon, that's just past. BBC News NI understands it is thought the majority of extra beds which are used in an emergency were already occupied. Now, this is at the Causeway Hospital up in the north of Ireland. So at least 7 ambulances were waiting to offload patients at Causeway Hospital on Saturday afternoon. Flu and respiratory infections have been affecting many people, with some requiring hospital treatment. So again, it's a seasonal thing. You know, winter time comes, The flu comes, people get sick. You're told to stay at home and, stay warm or take a Lemsip or do whatever the doctor orders. But now we're having people that are being admitted into hospitals, putting more pressure on the services there and resulting in, for example, at least 7 ambulances sitting waiting to offload patients at Causeway Hospital. So while those ambulances are being used as effective mobile hospital beds, they're not out there taking care of people that have maybe fallen ill, taken heart attacks, taken strokes, had bad falls, maybe been in accidents. I don't know. But they're out of action while they're sitting at the door of Causeway Hospital because there are no beds for the people that are inside. So 41 ambulances were queued outside Northern Ireland's emergency departments at 1 p.m. on Saturday afternoon. Think about that. 41 ambulances on Saturday afternoon were sitting outside the doors of hospitals, simply holding on to the people that were into them because they couldn't be discharged into the hospitals themselves. So 41 ambulances that could have been back out on the roads, could have been out dealing with people that were elderly, had falls, had heart attacks, strokes, I don't know what. Been in terrible accidents? I don't know. But either way, they weren't. They were decommissioned effectively. They were sitting at the doors of the hospital. So our so-called health minister, Mike Nesbitt, don't know what he knows about health up here, has warned about winter pressure faced by the trusts. Well, does this not happen every year? Is this not something that's ongoing every single year? And every single year we're told about the pressures that the hospitals are under, but yet nothing ever seems to be done to alleviate those pressures. He says winter preparedness plans were developed, but they were always going to mitigate the pressures rather than eradicate them. Well, whatever happened to dealing with the cause of the problem? Instead of putting a sticking plaster over this gaping wound, why not sew the damn thing shut and take care of this problem for once and for all? He goes on to say serious challenges are also being experienced in neighbouring health services, with flu cases a significant contributory factor. But I am assured that everything that can be done by the health system in the current situation is being done. That's no consolation for people that are sitting in ambulances outside A&E departments. That's no consolation for the elderly people that were sitting for 5 days in accident and emergency in the Royal Victoria Hospital. So maybe everything that can be done is being done, but it's not enough. And it's not enough for Nesbitt to turn around and say, well, we've made plans and we've tried our best, but we're not going to deal with the problem or eradicate the problems. We're simply going to mitigate the pressures. Well, if this is mitigating the pressures, I would hate to see the state that people would be in if nothing was done to mitigate the pressures. The problem is not new, it says here. An analysis being done by Mary Louise Connolly, BBC News NI health correspondent. Did the Department of Health's winter preparedness plan, published in early November, go far enough? Early November? Okay, well, that's pretty much into the winter time. I would have thought that a winter preparedness plan should have been prepared months and months and months and months in advance. And in fact, everything that was learned from the disasters of last winter should have been taken care of, and planning should have been done well in advance rather than releasing a plan in early November. Some of those currently working in the thick of it say that it did not go far enough. One senior emergency department consultant said that little had changed on the ground since November and things are likely to get worse. So leaving it late, number one. Number two, little has changed since this so-called emergency plan has kicked in. And number three, to add insult to injury, things are likely to get worse. So the mitigation that Nesbitt talks about, the senior consultant who's on the ground, who knows what he's talking about, has said that things will likely get worse. They won't be mitigated, and certainly the problem won't be eradicated. It will get worse. Among the criticisms is that the winter plan doesn't adequately address the basic issues which cause overcrowding and which delay people leaving hospital wards. The problem is not new. So here we have an admission. This is not something new. This is something that happens every year. And every year the same rhetoric is rolled out and the same excuses are made and nothing actually gets done. It's a bit of a disaster, as you can imagine, and no consolation for the people that are suffering at the minute. Altnagelvin Hospital at one point had 48 people waiting An ambulance had been waiting outside there for 9 hours. 9 hours. An ambulance was taken off the road to sit outside Altnagilvan Hospital. And not enough staff or space to facilitate crews or patients. It is understood. A BBC reporter said that at least 7 ambulances, I think I've already covered that, were waiting to offload at Causeway Hospital in Coleraine on Saturday afternoon. So this isn't localised to the Royal or Altnagilvan or Causeway Hospital. This is right across the board in Northern Ireland, and it's not much better in the south. So another thing to bear in mind now, we're looking at the so-called health service in Northern Ireland, is a number of people waiting for appointments with consultants, hospital consultants, more than 500,000 people. 500,000 people just in Northern Ireland or the north of Ireland are now on lists to have their first consultation with a specialist. Figures released by the Department of Health reveal that as of 30th September last year, this article was published at the end of 2024, 506,612 people had yet to be seen. The longest outpatient waiting list is for general surgery. You know, you need an operation. Bad news. That's the longest waiting list. However, every treatment specialist list has grown, with the exception of ophthalmology. So everything is getting worse. Again, not just with the situation on the ground in the emergency departments or waiting to get admission to wards, but on the waiting lists to see consultants. Also, patients waiting for ENT treatment have the second longest list, followed by gynecology. So unfortunate if you need some work done down below. You're third worst when it comes to the waiting lists. The figures have also shown that more than half of all patients have been waiting more than a year to be seen. Almost 110,000 patients are waiting on an inpatient or a day case admission to hospitals across Northern Ireland's 5 trusts or 5 health trusts. So those figures are up to the 30th of September. I'm not a gambling man, but if I was, I would say those figures have not improved any up until the 30th of September last year. Maybe I'm wrong. If I am, please feel free to correct me in the comments underneath underneath this video. The Department of Health advised that while caution was needed with the statistics, because of the introduction of new electronic record system Encompass, they gave a meaningful representation of current waiting lists. So in other words, they can't blame it on a new reporting system. Okay, they can't blame it on a new reporting system. They're saying the figures may not be 100%, but they're a fair indication of where we're at the minute, which is grim. To put it mildly, it is grim. Now, looking at the south, Trolley watch, 700 people, and I think this was published today, so this is accurate as per today. 700 people waiting for a bed in Irish hospitals, 444 waiting in the emergency department, while 256 in wards elsewhere in the hospitals. So these are the latest figures from the Irish Nurses and Midwives Organisation, INMO, and they show there are 700 people. That's insane. Can you picture 700 people? I mean, picture a group of 20 people, a group of 50 people, a group of 100 people, a group of 700 people waiting for beds in Irish hospitals, with 444 of those sitting waiting in an emergency department. And those are stressful environments, stressful for the staff, stressful for patients, stressful for visitors. People are really ill, people are sick, they can be full of drunks at night or even during the day, unhinged people in there. What a hell. What a hell to be sitting in an emergency department waiting for admission into a hospital while 256 are in wards elsewhere in the hospital. So one place in particular that's really grim. And if there's one place in Ireland that you do not want to be if you're sick or trying to get into a ward, it's University Hospital Limerick. This place is appalling. So they treated more than 23,000 admitted patients on trolleys last year. by far the highest number of any hospital in the country. So this is University Hospital Limerick. According to figures released by the Irish Nurses and Midwives Organisation, I've already shouted them out in the last slide, which records the national trolley figures each day in hospitals around the country. There were 23,000 odd patients treated in UHL across the 12 months of 2024. That is crazy. I asked you to try and picture 700 people on trolleys. Now try picture 7,000. Now try picture 10,000. Now picture 20,000. Now picture 23,000. And that's just one hospital in Ireland, in Limerick, last year. Insane amounts of people. Insane feelings by the Irish Health Service. Comparing to Cork University Hospital, they have the second highest figures with 13,000 admitted patients treated on trolleys while waiting for a bed. That's a grim figure as well, 13,000, and that's just another single hospital in Cork. But it pales in comparison to Limerick University Hospital. Limerick, almost twice as many, 23,000. So between Limerick and Cork University Hospitals last year, what are we looking at? 36,000 people treated on trolleys in those hospitals while they were waiting for a bed. The figures are equally grim in previous years with UHL, 21,500 patients on trolleys in 2023, a figure substantially higher than the 18,000 in 2022. So look at the trajectory here, 18,000 in 2022, 21,000 in 2023, 23,000 in 2024. How are the government not being questioned or arrested over this? This is gross negligence. Could be leading to the deaths, and has led to the deaths of people, and yet they're still being voted back in. Fianna Fáil, Fine Gael are still being voted back in. And you talk about the turkeys voting for Christmas. Ireland people, you need to wake up and give yourselves a good shake. 2022 was the year Shannon teenager Aoife Johnson died after being brought to the emergency department in University Hospital Limerick with sepsis. So this has led to deaths. And these people are still running the country. It's beyond a joke. And someone's actually speaking out against this, believe it or not. Sinn Féin TD Maurice Quinn, 2024 worst year on record for overcrowding at University Hospital Limerick. Well, he's just regurgitating the figures that I've just put forth. Deputy Quinn made his comments following the release of the figures that showed a further 85 people were treated on trolleys today. And I think that was at the tail end of last year, bringing the 2024 total up to the figure that I've already quoted of 23,203. And he says that successive Fianna Fáil and Fine Gael governments have utterly failed to deliver enough hospital capacity over the years, and added that their mismanagement of the health budget and decision to underfund the health service has left hospitals across the state, particularly in Limerick, without the beds that they need. And here we have the problem. Every year, it's the same. Every year, it's not the same, actually. If it was the same, it could be, looked upon as some kind of crazy achievement. But it's getting worse by the year. It's getting more chronic by the year. And every year they keep saying, well, we're not going to deal with the problem. We're simply going to mitigate the problem. In the case of Mike Nesbitt, or we have this Sinn Féin TD calling out Fianna Fáil and Fine Gael saying, they've been in power for years and they've done nothing about it. How are these people not being held to account? Is this not criminality of the highest order? So whether or not you agree with, different other things that the Irish government are implementing, throwing the borders open, flooding the country with people that shouldn't be here. We have no capacity to house them. And by the looks of it, no capacity to treat them should they become sick. Put that to the side and just think about this. Think about this. If that was you, if that was your mother, your father, your brother, your sister, your son, your daughter, whoever, your wife, your husband, would you want to be in this position? because it could be you. So what I'm saying is we need to keep an eye on what's happening here. And if you can afford to do so, I would strongly advise you to start looking around at some private medical insurance, because you do not want to be in Limerick if you need emergency care. You do not want to be in the Royal Victoria Hospital if you're an elderly person that needs a bed. You do not want to be in Galvin or Causeway Hospital sitting in an ambulance for 9 hours while you wait. And it's no fun for the staff either. They're the people on the front line that have to deal with this, because it's constant, persistent mismanagement of funds and gross ineptitude by the politicians of Ireland that have brought people to this place. And yet, they still keep getting voted in. So anyway, if you've liked this video, please feel free to share it, to spread it around, cut and paste the link, send it to other people. And if you haven't already done so, kindly subscribe to the channel. But as per now, this is me, Rick Munn, No Risk, No Reward Media, over and out.